Namaste, I am Dr. Nisarg Parikh, spine surgeon practicing at Swasti Spine and Mindcare Ahmedabad. So, friends, this week, which is from 14th April to 20th April, is celebrated worldwide as World Osteopathy Week. And on that occasion, I am going to share some very basic but yet very important tips how you can take care of your musculoskeletal system, your bone health, your joint health, etc. So first, let me explain you what is osteopathy. Osteopathy is a branch of medicine which deals with problems related to your muscles, your bones, joints, and the core of which is your spine. So if you are anyone, young athlete or a homemaker or a person who is doing desk job, this session is specially for you. So, friends, on day-to-day basis, we do commit very basic mistakes, and on the long run, it can damage your musculoskeletal system. It doesn't just give rise to pain, neck pain, back pain, etc. But on longer terms, it can have negative implication on your overall health as well. It can have some varied symptoms like disturbed sleep, headaches, digestive issues, etc. So, first and foremost, let me tell you the commonest mistake we commit on day-to-day basis and what we can do to rectify them. So, if you are working or sitting for a very long time, don't do slouching posture. If you are using desktops or screens, always try to keep them at your eye levels. If you are habitual of using mobile phones for excessive durations, it usually leads to issues like neck pain, text neck, upper limb radicular symptoms, etc. And guys, mind it very well, this issue is on rise. I am seeing a lot of patients having tech neck problems. Another issues I am seeing in the patients is that you do not get up while working for prolonged periods. So if you are working for longer duration, always use this 30-30 rule, which is get up at every 30 minutes and do some basic stretches for 30 seconds. This will help you to keep your spine and your musculoskeletal health, in good shape for longer periods. Another important aspect is nutrition. If you are very conscious about your nutrition, always try to incorporate these five elements in your daily diets. The first is calcium. Usually, dairy products, green leafy vegetables are good source of calcium. Another important nutrient is vitamin D. Sunlight is the commonest and most accessible source of vitamin D. Magnesium and zinc. Usually, nuts and banana. They are very good, rich source of magnesium and zinc. The fourth one is antioxidants and anti-inflammatory foods. If you are having food like walnuts, flax seeds, they can act as anti-inflammatory good source of anti-inflammatory oxidants. And these anti-inflammatory products, they just do not prevent damage, they also help us to repair the damage already caused by any kind of injury. And the fifth important ingredient is protein, be it a vegetable source or the non-veg source. Try to incorporate protein up to 1 gram per kilogram of your body weight on daily basis. Third important aspect is exercise. At least 30 minutes of daily exercise, 5 times a week, will keep your spine and musculoskeletal health very in good shape. You must start doing exercises right from beginning. Like if you are 20, 25, you must start doing exercise on daily basis, because this helps to increase your muscle strength, and it also prevents osteoporosis on longer term. After age of 35, 40, a person usually starts losing muscle mass on regular basis, and you start feeling fatigued. So if you are doing exercise on regular basis, like running, cycling, jogging, weightlifting in gym, swimming, etc., this will help you on very longer term and will keep your muscles healthy. And I'm also seeing many people who do go to gym on regular basis, but they forget to strengthen their core muscles. Guys, strengthening of your core muscles to keep your spine healthy is very essential and very necessary. The fourth important aspect is supplements. A person who has crossed age of 50 years, the digestion becomes weak, and whatever you are eating, it has very negative effect on your digestion, and you get very less nutrient as compared to your younger age. So a male person who has crossed age of 50, he should start taking supplements, or a female usually after age of 45, she should start taking supplements, especially when she is approaching menopausal age. The fifth most important aspect of maintaining your musculoskeletal health is identifying your symptoms in very early part. Usually we identify back pain, neck pain, or other joint pain as our commonly presenting symptoms. But apart from that, if these painful symptoms are persistent, like let's say for more than 3 weeks, you should consult a specialist. If there are other symptoms like pain going to upper limb, lower limb, feeling of weakness, fatigue, tingling numbness, or burning sensation in your hands or limbs, these are also a warning sign. In advanced cases, we are also seeing patients who have issues with their urinary and bowel hesitancy or urgency. If any of these symptoms are there, you must consult a specialist. Friends, it is not just an orthopedic surgeon or a spine surgeon who will keep your musculoskeletal system or osteopathy systems healthy. It is usually collaboration of multiple, branches and multiple specialties. A physiotherapist, a chiropractor, Ayurvedic doctor, orthopedic surgeon, physician, and at the same time spine surgeon. Collaboration of these specialty branches helps you to keep your musculoskeletal system healthy. So on, I just want to conclude with a simple message. Eat right, sit tight, and keep moving. This will help you on long way. And if you have any more questions, you can ask in chat box. And also, if you have questions later on, you can log in to my, you can contact me on my social media page, which is Dr. Nisarg Parikh and Swasti Spine and Mind Care. So I'm getting some questions here. We can address them one by one. So the first question is osteoporosis affects on spine also? Yes, absolutely. On the contrary, osteoporosis affects spine the most. So that is why if there is severe osteoporosis, we do see patients with multiple spine fractures in older age group. So that is why I told you, you should start taking supplements after you cross age of 50 years. Sir, which calcium is better? So if you are young, obviously the natural source of calcium, like from banana, dairy products, it is best. But usually after, if you are taking supplements, any calcium tablet along with vitamin K and vitamin D, it should work for you. Any more questions? I think we can conclude the session. Thank you, friends, for joining. Thank you.
Thank you, sir. Thank you very much for your valuable time.